People with robust social connections are more likely to live longer, healthier, and happier lives. But according to Census Bureau surveys, people were spending less time with friends and more time alone even before the pandemic, which only intensified the sense of social isolation and loneliness. Laurie Santos is a cognitive scientist and psychology professor at Yale University, where her class, Psychology and the Good Life, is one of the school's most popular courses. She's turned it into a podcast, The Happiness Lab. Laurie Santos, how pervasive is this problem in America right now?
I mean, it's pretty bad. It's often talked about as an epidemic. Some surveys reveal that around 60% of people in the US right now report feeling lonely on a pretty regular basis. And that's pretty devastating from a public health perspective, right? This is worse than rates of obesity. This is worse than rates of diabetes. And everything we know suggests that loneliness might be as big of a public health threat in terms of like the effect that it has on our bodies and our minds.
What's brought this on? Why? Obviously, the pandemic, I think it aggravated it. But even before the pandemic, people were talking about this.
Yeah, if you look at rates of loneliness, there's lots of evidence that they've been increasing linearly since the 1970s, right? And that's long before the pandemic. That's actually long before some of the other culprits, things like cell phones and so on. And so I think the evidence really points to the fact that there are probably a lot of causes going on at once, but those things are coming together to really make us a much more unhappy and a much more isolated kind of population right now.
What are some of those causes that are running together?
I think one of the big ones that we don't often think about is just time, right? People are busy, people are spending more time at work. I think that we just don't have enough free time to connect with the people that we care about. I think there's also lots of other interesting demands on our time. Back in the 1970s, there wasn't Netflix and all these video games and the kinds of things that we could be doing by ourselves to entertain ourselves. And I think also, like this social media wasn't around in the 1970s, but I think it is having a big effect, right? Our technology in theory is there to connect us socially. But how many times have you been to a restaurant and seen people not talking to the folks at their table because they were looking down at their phones? I think more and more we're connecting through our technology, but that means missing out on the kinds of connections we can experience in real life.
What are the health effects of loneliness?
I mean, they're many and surprising. So individuals who report feeling lonely are more likely to experience things like dementia, heart disease, stroke. It actually affects longevity, meaning that people who self-report feeling lonely are even more likely to die than those that aren't. Vivek Murthy, the current Surgeon General, estimates that reporting that you feel lonely is like smoking like 15 cigarettes a day in terms of its impact on our health and our well-being.
It used to be that a lot of this discussion about loneliness focused on older people, but retired people losing that sort of social connection of work, their spouses or partners may die. But are we seeing this more among younger people now?
I mean, that's the most striking thing, especially for me as a college professor, are the rates of loneliness that we see among our young people right now. So nationally, among college students, we see levels of loneliness around 60%, which was so striking to me, right? These are students who are young, who are living on campus, often in the dorms with other students, yet 60% of them are reporting feeling very lonely most of the time.
And explain that. Talk about that. They were living in a group situation, yet they're lonely. What sort of alone in a crowd?
Yeah, and I think interacting with their technology in a way that prevents connection in real life. I can't tell you how many times I've walked into my dining hall and seen, a crowd of students, each of whom have, big headphones on, looking down at their laptop screens, looking down at their phones. I think we're really missing out on the kind of connection that can happen when you talk to a person in person and you have that in real life social connection.
What can people do to avoid this? Or if people are feeling lonely, what advice do you have for them?
I think the first piece of advice is just to remember that it's a common problem. I think loneliness can feel stigmatizing. It can feel like there's something wrong with you if you're feeling lonely. But if you realize that, upwards of 60% of people out there are feeling the same, it's not such a bad thing, right? It's something that you can admit to. And I think admitting that you're feeling loneliness is part of the first step. I think one thing to do is then to make sure you're really connecting with the folks who you have in your life. One of the problems with being really busy is that we don't often take the time we need to connect with the people we care about, our friends, our family members. But it's as simple as picking up the phone to try to reconnect with them. I think there's also ways that we can try to make new connections. And this is something that I think we often forget to do, right? Again, it's too easy to stay in our house and watch Netflix. But, if you're watching the basketball game, could you head out to, a pub and watch that basketball game? If you're going to be doing something, engaging in knitting or even on a crafts, can you join a craft group and so on? This is another thing, a big change we've seen since the 1970s is that these so-called third places, places that people would meet with other friends, like bowling leagues and so on, these kinds of things have gone away in the modern day. But we can bring them back. We can take some action to make those kinds of collective social connections as well.
Laurie Santos of Yale University, thank you very much.
Thanks so much for having me on.